Most people think a heart attack starts with chest pain, but what if I told you that your jaw hurting or feeling a little tired could be your only warning before everything goes black? Margaret was in her kitchen making coffee on a Tuesday morning, just like she had done for 30 years. She felt fine. Her doctor had given her a clean bill of health just 6 months earlier. Her blood pressure was good. She walked every day. But then something changed. It started with a strange tiredness that felt different from anything she had experienced before. Not the kind of tired you feel after a long day, but something deeper. Something wrong. Within minutes, she was on the floor, struggling to breathe. The paramedics later told her family that she had suffered a massive heart attack. The scary part? She never felt any chest pain at all. Margaret's story is not unusual. Every year, thousands of Americans over 55 experience heart attacks that don't match what they see in movies. There's no dramatic clutching of the chest. No sudden collapse. Instead, the signs are quiet, confusing, and often dismissed as something else entirely. Today, we're going to talk about these hidden warning signs that could save your life or the life of someone you love. When most people think of a heart attack, they picture someone grabbing their chest in pain. This image comes from movies and television shows, but real life is often very different. Medical studies show that up to 40% of heart attacks happen without the classic chest pain that we all expect to feel. This is especially true for people over 55. As we age, our bodies change how they send us warning signals. The crushing chest pain that younger people might feel during a heart attack often becomes much more subtle in older adults. Sometimes it feels more like heartburn or indigestion. Other times, there's no chest discomfort at all. The problem is that when we don't feel that expected chest pain, we tend to ignore other important warning signs. We tell ourselves it's just getting older, or maybe we ate something that didn't agree with us. But your heart might be crying out for help in ways you never learned to recognize. Understanding this simple fact could be the difference between getting help in time and facing a much more serious situation. Here's something that might surprise you. Jaw pain can be one of the first signs that your heart is in trouble. It sounds strange, but there's a medical reason why this happens. The nerves that carry pain signals from your heart travel through your neck and jaw area before reaching your brain. When your heart muscle doesn't get enough oxygen, it sends out distress signals. But sometimes these signals get confused along the way. Instead of feeling pain in your chest, you might feel an ache in your jaw, almost like you have a toothache. Some people describe it as feeling like they've been clenching their teeth too hard. This jaw pain often happens on the left side, but it can affect both sides. It might come and go, or it might stay constant. The key thing to remember is that if you're experiencing unexplained jaw pain, especially if it comes with other symptoms we'll talk about, it's worth taking seriously. Many people waste precious time visiting the dentist or trying pain relievers when they should be calling for medical help. Your jaw might be trying to tell you something very important about your heart. Have you ever broken out in a cold sweat for no clear reason? Maybe you felt dizzy while sitting in your favorite chair, watching television. Most of us would brush this off as just one of those things that happens as we get older. But sometimes your body is trying to tell you something urgent. When your heart struggles to pump blood effectively, your body goes into a kind of emergency mode. It starts redirecting blood flow to your most important organs, like your brain and heart. This can leave you feeling dizzy, lightheaded, or even nauseous. At the same time, your body might start sweating as it works harder to keep everything functioning. These symptoms are easy to mistake for other things. Maybe you think you're coming down with the flu. Perhaps you ate something that didn't agree with you. Or maybe you just stood up too fast. But when these feelings happen together, especially if they persist, your heart might be sending you an important message. The difference between normal dizziness and heart-related dizziness is often in how it feels and how long it lasts. Trust your instincts if something feels different or wrong. This might be the most frightening thing you learned today. Some heart attacks happen with almost no symptoms at all. Doctors call these as silent heart attacks, and they're much more common than you might think. Studies show that about 20% of all heart attacks are silent, meaning the person having one doesn't realize what's happening. Silent heart attacks are especially common in people over 60. They're also more likely to happen to people with diabetes, because diabetes can affect the nerves that carry pain signals from the heart. Without those pain signals, your heart could be in serious trouble while you go about your normal daily activities, completely unaware. The scary truth is that silent heart attacks cause just as much damage to your heart muscle as the ones that cause obvious symptoms. The difference is that without clear warning signs, people don't get the immediate medical care they need. This means the damage can be more severe, and the risk of future heart problems is higher. Sometimes the only way people discover they've had a silent heart attack is during a routine medical test or checkup. By then, weeks or even months might have passed since the actual event. We all get tired. After a busy day or a poor night's sleep, feeling fatigued is perfectly normal. But there's a different kind of tiredness that can signal heart trouble. It's a fatigue that feels overwhelming, unusual, and doesn't get better with rest. Think about how you normally feel when you're tired. You might want to sit down or maybe take a nap, but you still feel like yourself. The fatigue that can come with heart problems is different. People often describe it as feeling drained of energy, like their body is working much harder than usual to do simple things. This kind of fatigue might make climbing stairs feel like running a marathon. It might make simple tasks like getting dressed or making breakfast feel exhausting. Some people say they feel like they're moving through thick mud, even when they're just walking across the room. Women are especially likely to experience this type of fatigue during a heart attack. If you find yourself feeling unusually tired for no good reason, especially if it comes with other symptoms, it's worth paying attention to. Your heart might be working overtime, and your body is telling you it needs help. Feeling short of breath after walking up a flight of stairs is normal. Feeling short of breath while sitting in your favorite chair is not. When your heart isn't pumping blood effectively, your lungs have to work harder to get oxygen to your body. This can make you feel like you can't catch your breath, even when you're not doing anything physical. This type of breathing problem might start gradually. Maybe you notice you're slightly more winded than usual when you walk to the mailbox. Or perhaps you find yourself needing to prop up extra pillows at night because lying flat makes it harder to breathe. These changes can happen so slowly that you might not notice them at first. The key difference is that heart-related shortness of breath often happens when you're at rest or doing very light activities. It might feel like there's a weight on your chest, making it hard to take deep breaths. Some people describe it as feeling like they're breathing through a straw. This symptom is particularly important because it often gets worse over time if the underlying heart problem isn't treated. What starts as mild shortness of breath can progress to more serious breathing difficulties if ignored. Here's where things get really tricky. Sometimes a heart attack feels exactly like a bad case of indigestion. You might feel nauseous, like you need to throw up. Your stomach might feel upset, almost like you ate something that disagreed with you. This happens because the nerves that serve your heart also connect to your stomach area. Many people, especially women, experience nausea or stomach discomfort during a heart attack. They might feel like they have heartburn or acid reflux. Some people actually do throw up. The natural response is to take an antacid or wait for the feeling to pass. But sometimes this indigestion is actually your heart calling for help. The challenge is knowing when stomach problems might be heart problems. The key is to pay attention to the whole picture. If your indigestion comes with other symptoms like sweating, fatigue, or jaw pain, it might not be your stomach at all. This is especially important to remember if you don't usually have stomach problems. If you suddenly develop what feels like severe indigestion, and it doesn't go away with your usual remedies, consider that it might be something more serious. When in doubt, it's always better to be safe. Pain in your back or shoulder might be the last thing you connect to your heart. But just like jaw pain, these aches can be your heart's way of asking for help. The pain usually happens in the upper back, between your shoulder blades, or in your left shoulder and arm. This pain often feels different from the muscle aches you might get from gardening or sleeping wrong. People describe it as a deep, aching sensation that doesn't go away when you change positions or stretch. It might feel like someone is pressing firmly between your shoulder blades, or like your left arm is unusually heavy. Interestingly, men and women often experience this pain differently. Men are more likely to feel it in their left arm and shoulder. Women might feel it more in their back, neck, or both arms. Some women say it feels like someone is squeezing their shoulder blades together. The important thing to remember is that this pain often happens along with other symptoms. By itself, back or shoulder pain is probably just back or shoulder pain. But when it comes with unusual fatigue, shortness of breath, or that strange feeling that something isn't right, it deserves your attention. Your heart has been beating steadily your entire life, so you probably know how it normally feels. That's why it's important to pay attention when something changes. During a heart attack, your heart rhythm might become irregular. You might notice your heart skipping beats, beating too fast, or beating in an uneven pattern. Sometimes these rhythm changes feel like fluttering in your chest, almost like butterflies. Other times, it might feel like your heart is pounding, even when you're sitting quietly. Some people describe it as their heart jumping around inside their chest. These changes happen because when part of your heart muscle isn't getting enough oxygen, it can disrupt the electrical signals that control your heartbeat. Your heart might try to compensate by beating faster, or the damaged area might cause irregular rhythms. Not every irregular heartbeat is a sign of a heart attack. Many people have harmless rhythm changes as they age. But if you notice sudden changes in how your heart beats, especially if these changes come with other symptoms we've discussed, it's worth taking seriously. Your heart's rhythm is trying to tell you something important about what's happening inside your chest. If you were born between 1946 and 1964, you belong to a generation that faces unique heart risks. This isn't anyone's fault, but it's important to understand why. As we age, our arteries naturally become less flexible. The walls of our blood vessels thicken. Our hearts have been working for decades, and like any hard-working muscle, they can show signs of wear. But there's more to it than just age. The baby boomer generation lived through some significant changes in American lifestyle. You grew up when smoking was common and socially acceptable. Fast food became popular during your young adult years. Many of the foods that were marketed as healthy in the 1970s and 1980s turned out to be high in sugar and unhealthy fats. You also lived through decades when stress was often seen as just part of working hard and getting ahead. Many boomers spent years in high-stress careers, often working long hours and putting their health second to their responsibilities. This combination of factors creates what doctors call a perfect storm for heart disease. The good news is that understanding these risks means you can take steps to protect yourself. It's never too late to make changes that can help your heart stay strong for years to come. Here's something that might surprise you. Heart attacks affect men and women differently, and these differences become more pronounced as we age. For decades, medical research focused mainly on how heart attacks happen in men. This means that many of the classic symptoms we all know about are actually more common in men than women. Women are more likely to experience what doctors call atypical symptoms. Instead of crushing chest pain, women might feel pressure or tightness. Instead of pain radiating down the left arm, they might feel it in both arms, their neck, jaw, or back. Women are also more likely to experience nausea, shortness of breath, and overwhelming fatigue. This difference is partly because women's hearts are smaller than men's hearts, and their blood vessels are narrower. When these smaller vessels become blocked, the symptoms can be more subtle and harder to recognize. Women are also more likely to have heart attacks that involve smaller arteries, which can cause different types of symptoms. Unfortunately, this means women are more likely to delay seeking help, and they're more likely to have their symptoms misunderstood, even by medical professionals. If you're a woman experiencing unusual symptoms, trust your instincts. You know your body better than anyone else. One thing you remember from this entire video? Let it be this, the feeling that something is terribly wrong. Doctors have a name for this. They call it impending doom, and it's one of the most important warning signs of a heart attack that people consistently ignore or dismiss. This feeling is hard to describe, but people who have experienced it say they knew something was very wrong with their body, even when they couldn't pinpoint exactly what it was. It's not just worry or anxiety. It's a deep physical sense that something bad is happening inside you. Some people describe it as feeling like they might die, even though they can't explain why they feel that way. This symptom happens because your body has amazing ways of detecting danger, even when your conscious mind doesn't understand what's happening. When your heart is in serious trouble, your body releases stress hormones and activates your nervous system in ways that create this overwhelming sense of alarm. Many people dismiss this feeling because it seems too vague or too emotional. They think they're just being dramatic or letting their imagination run wild. But this instinct has saved countless lives. If you ever feel this way, especially with other symptoms, don't ignore it. Trust what your body is telling you. The first 5 minutes after heart attack symptoms begin are the most important 5 minutes of your life. What you do during this time can determine whether you survive and how much damage your heart suffers. Here's exactly what you need to do, step by step. First, don't ignore the symptoms or hope they'll go away. Call 911 immediately. Don't call your doctor. Don't call a family member first. Don't try to drive yourself to the hospital. Ambulance crews can start treating you right away, and they can get you to the right hospital faster than anyone else can. While you're waiting for help to arrive, sit down and try to stay calm. If you have aspirin available and you're not allergic to it, chew 1 regular aspirin or 4 baby aspirins. This can help prevent your blood clot from getting worse. Don't take aspirin if you're allergic to it or if your doctor has told you not to take it. If you're with someone else, have them stay with you and unlock your front door so paramedics can get in easily. If you're alone, try to unlock your door if you can do so safely, then sit down near the entrance. Don't lie down unless you absolutely have to because sitting up helps your heart pump more effectively. Remember, every minute matters when your heart is in trouble.